Good afternoon. I'm Dr. Lanka. I'm a consultant pulmonologist and immediate past president of the Sri Lanka College of Pulmonologists. So we are now in 2025. COVID or coronavirus viral infection 19 came in 2019, and we are still talking about it, and we are still concerned about it. So we wanted to actually, as a Sri Lanka College of Pulmonologists, to discuss about the current status of the COVID infection in the world as well as in the country, mainly to alleviate some unnecessary fears among the public regarding COVID infection. So, what we have to understand is COVID is a virus, it's an RNA virus, and it constantly evolves itself, it constantly mutates itself, and it comes into variants as well as various subvariants. So each day, millions of viruses are replicating throughout the world, and as a result, there are a lot of subvariants and variants of COVID that are there in the country as well as in the world. So what this variant does is some of these variants can be harmful, some of these variants might not be harmful. So we basically categorize variants of COVID infection into three important areas. One of the major importance is what we call variant of concern. Variant of concern has an increased tendency to give the disease to another person, that is the transmissibility is increased. And the second thing is it can cause increased severity of the disease. That means the amount of people who are admitted into hospital as well as dying because of COVID increases. And the third thing is some of these variants cannot be controlled by the current vaccines and the current treatment. So when that happens, it becomes a variant of concern. So current variants that is there, it is the current variant that is there is not a variant of concern, but it is currently a variant of monitoring according to the WHO. Hence, the most important thing is it's being monitored at the world stage as well as in the Sri Lankan stage, and it is being, thought of having less problematic areas than the previous Omicron and Delta variant at the moment. So, especially in countries like UK, it has not caused significant increase in hospital admissions or death, but in certain countries like Hong Kong, it has caused mild rise in hospital admissions as well as deaths. So the current variant is basically what we call a variant of monitoring, not a variant of concern. So that is the most important thing that we have to think about. So talking about these viral respiratory infections, and during the last 2 months, I think we had a huge surge of fever with respiratory symptoms. And when we analyze the data, majority of them had influenza, which is the commonest organism that is causing significant comorbidities and respiratory illnesses amongst the people of Sri Lanka. And COVID accounted to about almost 10% of the illnesses that were there, and out of which about only 2 to 3% were the new variant that was analyzed and identified by the epidemiological unit as well as the virological units in Sri Lanka. So at the moment, the most important thing is to identify who the people are at risk and prevent them from getting the infection of COVID, because sometimes in patients who are older than 65 years, who especially have specialist comorbidities like chronic renal disease, and patients who are renal transplant or organ transplant patients, as well as the patients who are having chronic lung diseases specifically, they have a higher tendency to develop severe disease due to COVID, even though they are vaccinated, and they can have a higher risk of getting serious illness and die because of COVID illness. And at the same time, we have to protect our pregnant population as well. So one important thing is to prevent the spread of COVID amongst the population. So there are various health, the normal health etiquettes, cough etiquettes, and infection preventive measures that we used previously. Washing your hands and washing your hands regularly, not touching your face, and especially if you have an infection, if you have a fever and a cough, better to wear a mask yourself as well to prevent others from getting infection. And one of the most important thing is to the parents. If your child is ill with cough and fever, don't send the child to the school. Sometimes it might be dangerous to the child as well, and you'll be spreading the disease to a lot of children as well. And sometimes these children will not get severe disease, but in those houses there will be elderly people more than 65 years. Sometimes our children are looked after by our grandparents who has multiple comorbidities, and they might be infected and they can have serious consequences as well. Especially if you have a pregnant mother, usually our young children have a mother, 4-year-old child, his mother is pregnant, they can give the disease to the mother and can have significant problems with the children getting the disease without any control. So, but if we go according to the control measures, I think that is the best important thing. And if we have a suspicion that we have the disease, it is very important to seek medical treatment as early as possible. So the final message is COVID is here to stay, and sometimes, like in influenza, there can be peaks or pandemics that can happen in the world due to various mutations that are there in the viruses. But it is very important to monitor these trends, which is currently done by the CDC as well as the WHO. And the final message is current variant that is circulating is under monitoring, but at the moment doesn't cause significant concern at the moment. But we, as especially high-risk patients with the multiple problems, health problems in their bodies, as well as pregnant patients, as well as people more than 65 years, should seek special precautions to prevent getting infected with any viral infection. Thank you very much. If there are questions, I can answer. Even in single, you can ask if there are questions, I can answer. Right, okay. Thank you. Bye.